Doctor, thanks for joining us today. It's that time of year. It's cold and flu season. It comes as the weather starts to cool. And one of the questions that I think people have is, how do I know if it's the flu or how do I know if it's cold?
Well, there's some overlap between the two illnesses, but in general, colds have a slower onset. They'll usually start with a scratchy sore throat, and then over the course of a couple of days, you'll get increased nasal secretions, a runny nose, basically. And then maybe within 3 to 5 days, you may develop a cough. Usually have very little, if any, fever, and usually not too much in the way of systemic symptoms like muscle aches, etc. And the recovery is usually within 5 to 7 days, and usually you're back up to full strength within a week or so. Influenza is a much more severe illness usually, although not in everybody. It has a much more sudden onset more often than colds. Usually there's a sudden onset of oftentimes a cough, maybe a little bit of nasal congestion, but not really a profuse runny nose like people with flu get. Oftentimes there'll be severe muscle aches, and most importantly, oftentimes there's a fever elevation above 100, oftentimes above 101. And the duration of that illness is usually about like a cold, maybe 3 to 5 days in most people, although it can be longer. And folks are usually sicker longer and may take a week or even 2 weeks to recover. So in general, influenza is a much more sudden onset of an illness, more severe illness than colds are, and the respiratory symptoms, particularly cough, are more severe.
Are the symptoms different between seasonal flu and the H1N1 flu about which we've been hearing so much?
Not really. There's not a lot of difference, although people that are seeing a lot of the H1N1 have noticed a little more in the way of gastrointestinal complaints, nausea, vomiting, maybe some diarrhea. But the major symptoms, which are sudden onset, generalized muscle aches, cough, nasal congestion, those overlap pretty much completely between those two. So as physicians, I think just seeing a patient, there are no specific symptoms that would allow us to say this patient is more likely to have a swine flu or H1N1 and this patient is more likely to have regular garden variety seasonal flu.
If I have flu-like symptoms, how do I know when it's time to see the doctor?
Well, if you're in a high-risk group, and there are several high-risk groups, very young people, children less than 2 years old. If you're older, say 65 years or older, those are high-risk groups. And then anybody that has some serious underlying heart or lung ailment or some other serious underlying chronic disease like diabetes, or for instance somebody with cancer on chemotherapy. So in general, if you're in a high-risk group, very young or very old, or if you have some serious underlying illness, or if you just are very, very ill, particularly if you're having worsening shortness of breath, if you're having a severe headache, if you've vomited a lot and you're getting dehydrated, or if you're taking care of a patient with flu and they're starting to get incoherent or not thinking clearly, so more severe illness. In those instances, you want to call your doctor or come into the emergency room if it's a very severe illness. But for milder degrees of illness, or if you're not in a high-risk group, the best thing to do is to stay home and not infect others.
How do physicians determine whether or not I really have the flu?
The main thing we go on are what we call clinical criteria, which are the symptoms that I've already discussed. There aren't any tests that absolutely can tell us. So the first thing we rely on is the patient's history, typical symptoms, obviously physical examination, and then there is a nasal swab test. It is oftentimes, but not always, positive in patients that have flu. So we can use the nasal swab test to tell us if it's positive, that's a good indicator that the patient does have flu. But if it's negative, people can still have flu. So the most important thing are the presenting symptoms and the examination of the patient. And then the nasal swab test can help us, but won't tell us absolutely whether the patient has the flu or not. Unless it's positive, then we know.
How is the flu treated? How is a common cold treated? How do they differ? How are they the same?
Well, if you have a milder illness, whether it's a cold or flu, then the treatment is pretty much the same, which is stay at home and supportive measures. You can take ibuprofen or Tylenol for fever, obviously stay well hydrated, rest. But both influenza and cold are caused by viruses, but fortunately we have antiviral antibiotics for the flu, two specifically that we can give for patients with the flu. Now, the catch with these medications is we need to start them inside of 48 hours. So if somebody falls within one of the high-risk categories I just discussed, or if they're more severe and they think they need to see a doctor, it's very important that they make that call early on in the illness so they can get started on one of the antiviral treatments we've got, which are relatively effective. They reduce the severity and the duration of the illness.
I'm going to ask you a two-parter here. Are there comfort measures that can be taken with the flu, and are there things that you can buy over the counter that will help you with the flu?
I think the most important thing with the flu is just you can treat the underlying symptoms. Probably rest and just good hydration are the most important things. For fever, you can take Tylenol or ibuprofen if you need it for muscle aches and fever, and that's about it, really.
Is there anything that you would recommend with respect to with a cold for a nasal discharge that's effective?
Yeah, antihistamines are fairly effective, and so antihistamines like chlorpheniramine that you can get over the counter. These medications do have some side effects, sedation or making people drowsy. Also in older men, they can cause a decrease in urinary flow. So there are some potential side effects, but those medications can help some with the congestion.
Thank you very much, Doctor. We appreciate your time.
Sure. It's my pleasure.